Hello everyone, this is Dr. Sarosh Siddiqui from the platform of UKMLA with DSS, and welcome to the second lecture of the success course for the UKMLA 2 exam. In the previous lecture, we discussed on what are the different components of the exam and how you will be basically marked in each different component. And then we also discussed a few tips and tricks to make sure that you are covering all the check boxes and make sure that you are covering all the things that are necessary to score high in a particular component. Now let's dig a bit deep into what the UKMLA exam is and what are the different type of stations and what are the kind of scenarios that you should be expecting in the exam. This is like very important before you start jumping into the preparation, before you start reading the notes, before you start off practicing with a partner, before you even think about opening any books or think about practicing a particular scenario with someone, because the more you invest in understanding this exam and the more you invest in getting clear on what to expect in the exam, you would automatically be at a higher level as compared to other people who are just preparing without having any idea that what they should be expecting in this exam on the exam date. Okay. So, in the previous lecture, as I told you, that there are 16 different stations on which you would be tested. But those 16 different stations would consist of different categories and different type of scenarios on the basis of which the GMC would be testing you on different things. Okay. And it's very important to first of all highlight that what are those categories, okay, and what are those scenarios. And then very important is that you should be able to identify by just reading the task, by just reading the scenario, that okay, this is a counseling station, okay, this is a issue taking station, okay, this is an ethical scenario, so I need to be keeping in mind the ethical considerations that are important for platform. So this is what we are going to discuss in this lecture today. Okay, so without wasting any time, let's just begin. So as you can see on the screen that I've mentioned the categories. There are different categories of the exam, and there are some counseling stations, ethical stations, medical history taking, sim and prescription. And if you start naming it, there are around 8 to 10 categories. Okay, and then some of those categories are further divided into some subcategories. Like for example, counseling station may have different type of counselings. Okay, it may have a test result counseling, it may have a follow up, or it may have a lifestyle modification counseling. And same goes for the ethical scenarios. It may be a breaking bad news station, or talking to a colleague, or maybe managing an angry patient. Okay, so I'm going to give you a detailed overview, okay, on what are the different type of stations. And on the screen, you might see some topics as well that are mentioned. But don't just rely on these topics, because it's been a while since I've updated the list. So these are the like old topics that have been showing up in the exam for a very long period of time. But there are new cases that are constantly being added up. So you make sure that you do not just rely on the list of the topics that I mentioned over here on the screen. Uh, Make sure that you do the recalls, and make sure that you do the new scenarios as well, in order to make sure that no station and no scenario is completely alien to you on the exam day. Okay, so let's just start discussing the first category. Okay, the first category of the UKMLA exam is the counseling stations. Okay, and why I've kept it at the very first is because the counseling stations, they subdivide and they further branch into many different categories. Okay, number one, there can be a test results counseling. Okay, you may find a station in which there would be some test results that will be given to you, and a particular patient or a relative may come to you to understand and to receive the test results. So you would have to explain the test results and talk about it and manage their concerns. Okay, that is the first subcategory of the counseling stations. Okay, then moving on is the lifestyle modification counseling. So the lifestyle modification counseling stations are not very uncommon in the exam. They keep on showing up, and it's a very important skill set that a doctor should know, because in the UK they very much value the aspect of lifestyle modification, and it's always there in the management of the doctors as well, of the consultants as well. So you should be aware of how to counsel a patient on modifying their lifestyle. Okay, there can be a patient who might be coming to you uh, with a habit of smoking, or with a habit of taking alcohol, and maybe the patient might be obese. Okay, and they may or may not have some diseases that is associated with these lifestyle habits that are not healthy. Like they might be having COPD, they might be having angina, they might be having stroke. So you would have to relate, and you would have to talk to the patient in respect to their condition, and at the same time modify their lifestyle, and try to counsel them on the importance of these lifestyle modifications. Okay, that is the second category. All right. Then another very common category that you're gonna see in the exam is the explanation. Okay, so sometimes a patient may come to you with a concern of a vaccine maybe, or they might want to understand about a particular procedure or a particular investigation. Okay, and they just want to know about it. Like they might just come to you and they say that, okay doctor, I just want to know about the flu vaccine. Okay doctor, I just want to know about XYZ method of contraception, can you please explain it to me? Okay doctor, I want to know about what a colonoscopy is. Maybe the patient might have colorectal carcinoma, and some doctor might have counseled him about getting a colonoscopy done, but maybe in that particular session he wasn't explained what colonoscopy is. So that would be your task to explain that particular procedure. Okay, so that is another subcategory that you may encounter in the exam. Then there are many follow-up scenarios in which a disease may already be diagnosed, but the patient may be coming to you for a follow-up. Maybe it can be a routine follow-up as well, or it can be a requested follow-up as well if the patient might be having some concerns. And those concerns can be anything. It can be any complication of the disease, or it can be the side effect of the drug, or it can be an ineffective treatment, or maybe they may come to you for a follow up with a completely different complaint, with a completely different symptom, with a completely different uh, disease. Okay, so the follow up sessions can go anywhere, but there is a long list of follow up sessions, and there is a specific way on how you are going to deal with the counseling sessions in which you have to deal with the follow up scenario. Okay, then there would be some cases in which you wouldn't be just talking to the patient, but there might be a very strong possibility that you are talking to the relative. Okay, specifically in the pediatric cases, most of the time you would be talking to the mother. Okay, and in the cases in which you're dealing with elderly patient, in the cases where the patients are terminally ill, or the patients do not have a mental capacity. Okay, in those cases you may be dealing with the relatives. Okay, so you should know, you should have an idea that, okay, how should I talk to a relative, because talking to a patient is a lot different as compared to talking to the relative. Okay, your tone would be different, your structure would be different. Okay, the way you begin your conversation would be different, but you need to be aware that you may have to talk to a relative. Okay, then there might be some patients who might be demanding a particular procedure, or might be demanding a particular investigation that they may not need. Okay, so you would have to deal with those patients, and you would have to counsel them and convince them that, okay, this is not for them. All right, and on the contrary, there may be some patient who might be refusing a treatment, a very critical patient not willing to get admitted, a very critical patient not willing to get a particular investigation done for whatever reason, but they might be refusing a particular treatment, and then you would have to counsel those patients that, okay, this is not the way to go about it, and they should get admitted because their condition can be potentially fatal, or if they don't get it treated right now, things can worse, and like use those things, okay, that are required to make sure that the patient agrees to you, okay. So that is the refusal counseling. Then there is a category in which the patient may be getting discharged, okay, like for example an epilepsy patient getting discharged. So what are the discharge advices that you're going to give to the epilepsy patient, like for example avoiding trigger, making sure that you don't go into places where there are flickering lights, avoid noise, get good sleep, stay hydrated, okay. And then what are the things that you need to take care of, and in case if you um, get an epileptic attack, what are you going to do about that, how are you going to manage it, how are the parents of a child who is diagnosed with epilepsy getting discharged going to identify epilepsy and going to provide the first aid before the medical help arrives. So all of these things, and this is one example, epilepsy. There are 3 to 4 different cases of the patients who are getting discharged, and you have to counsel them on their discharge. Okay. Then the last category, and this is a category which they did not add a very long time ago. It's very recently added. That is the learning disability. It's been here for a couple of years, and so this is where things get difficult because counseling is already a tough job. To be very honest, it's not actually easy to understand the counseling stations and counsel the patient, because counseling is something that is an art and that needs to be learned, okay, and that needs to be done in the very right way. But counseling a patient who already has learning disability, that is what makes things even more difficult, okay. And because the patient with learning disability, he or she may not be able to understand what you are saying, okay. Maybe you're going too fast, maybe you're not using layman words, maybe you're using medical jargons, maybe you're using too complicated terminologies, because somebody has learning disability. So what GMC tries to test in these type of situations is that, okay, you should understand that this person already has some difficulty in understanding. Now how are you going to be at the highest level of your counseling, at the highest level of your reassurance, to make sure that you are able to counsel the patient properly? You make sure that you are able to communicate the things properly to a patient who already has some difficulty, okay. So these are the different categories and the 9 different subcategories that comes under the counseling session. Okay, so more or less in all of these 9 different categories that I talked about, you would have to follow a similar structure. The structure is not very different for all these different 9 type of subcategories that I talked about. However, yes, the follow-up stations, they do have a different structure that needs to be followed. And as far as the structures are concerned, we are going to discuss each and every structure in the upcoming lectures, in the upcoming course. Okay. So this was what the counseling station was. Okay. Now the other categories is the speciality. Okay, they might be testing you on psychiatric cases, different psychiatric cases, and there are these 8 to 10 different psychiatric cases, and it has been like this for a very long time. They do not change a lot. They haven't added a lot of new psychiatric cases, but you need to make sure that the psychiatric cases are very well studied and you have very well practices, because there wouldn't be a day on which you won't find a psychiatry case. Okay, so very important category. Then dermatology, the patient might be coming with some dermatological concerns, and you might have to diagnose the dermatological condition and manage it. Okay, and dermatology is a huge list, and there are like around 30-40 cases of derma that different cases that are there, and you need to be able to identify these cases. You need to know the management of all of these cases, because derma cases do show up very frequently. Then pediatrics, there wouldn't be a day on which you wouldn't encounter a patient who is from the pediatric group. So very important category. And as I mentioned about the structure, there is a completely different structure to go about when it comes to the peds group, when it comes to children. So you need to be able to, uh, make sure that you have studied this particular category really, really well. Okay. Then there is the obgyn, different obgyn cases might be there. Women with different problem may come to you, maybe for counseling as well, or maybe for any diagnostic purpose. So you're going to encounter the OBGYN category a lot in the exam as well. Surgical cases are not very common. Okay, they are not very commonly tested, but yes, there are a few surgical cases, like you might have to do the preoperative assessment of the patient, or you maybe have to explain a particular procedure to a patient, or maybe post-operative patient getting discharged, you may have to counsel them. And there might be some surgical cases that may come to you as diagnostic sessions with presenting complaints that you may have to diagnose, and then talk about the surgical management of these cases. Okay, so again, a very important category. All right, then we've got ophthalmology, that is eye, and ENT, in which we can have multiple presenting complaints leading to different diagnosis. And for these two categories, it's very important to understand that they may come to you as combined stations. Okay, I'll talk about these combined stations later on, but do remember that because in like most of the cases, I and ENT cases are usually not just pure history taking stations. They usually come as combined stations in which you actually have to perform the examination. Okay, you cannot just get away by naming the examination. Okay, so INENT stations can get a bit tricky because you have to take the history, you have to do the relevant examinations, and then you have to give the diagnosis, and then you have to manage the patient, and then you have to address their concerns. So it's a lot to do in 8 minutes. Okay, specifically for the I and the ENT stations. All right. Then moving on to the next category, that is the ethical scenarios. Okay, so the ethical scenarios, they do not have a single structure. Okay, each different type of ethical scenario have a different way to go about it. Okay, it's a completely different story when it comes to different type of ethical scenarios that are there, but I can list them down for you. Okay, and later on in the course, you'll find out that okay, how to go about a particular type of ethical session, and how to go about, and what to say, and what are the structures that I need to follow if I want to make sure that I'm doing the ethical scenarios all right. Okay, so the first category, which is very famous and very commonly tested, again, there wouldn't be a day on which you would not find Breaking Bad news. The Breaking Bad news will always be there on your exam. Okay, because it tests a very high level of your ethics. Okay, a patient can come with any complaint, any bad news that might be happening to the patient. Maybe it can be a stroke, it can be subarachnoid hemorrhage. A patient may be diagnosed with osteosarcoma or any cancer. Okay, or maybe the patient might have had any intraoperative or postoperative bleeding. Okay, there would be a bad news. Okay, there would be the sad element involved in it, and what you need to do is that you need to break that bad news to the patient in a very nice way, patient or the relative in a very nice way. Okay, then there are some cases of abuse and non-accidental injury, very commonly tested, because the GMC knows that these are the type of cases which IMGs don't usually encounter in their normal clinical practices. Okay, abuse victim do not open up and do not seek help, so they know that this is a tricky component, and they know that this is a sensitive topic as well, and that is why they do commonly test the abuse and the non-accidental injury cases when it comes to the ethical scenarios. Same goes for the LGBTQ as well, because most IMG are coming from those areas and those countries where the LGBTQ aspect is not very common, and it's considered a taboo. and they know it very well that the IMGs are not very comfortable in talking about it, and the IMGs usually don't encounter these cases in their daily clinical practice, and that is why they deliberately, uh, give the LGBTQ aspect, and somehow or the other they might incorporate it into a normal history taking session. They might bring someone from the LGBTQ group to get counseled about a particular condition. Okay, but that aspect, somehow or the other would be tested, because in the UK it is like very very common, it is widely accepted, and they're not discriminated at all. So that is something that you should be aware of. Okay, the next category is the problem colleague. It doesn't sound well, problem colleague, but what it means is that maybe your colleague is causing some problem. Okay, maybe your colleague is not behaving up to the mark. Maybe your colleague is coming late to the ward, or maybe he or she is doing some drugs or taking alcohol, and then under the influence of alcohol, the doctor may be seeing some patients, or maybe the colleague is posting a few things on the social media that may not be appropriate as a doctor. So scenarios like these, so you understand, like real life scenarios, because all of these things do happen in real life. You, at some point or the other, you may have to talk to your colleague, you may have to have some difficult conversations with your colleague. Okay, so that is what is also tested in the ethical scenarios. All right, then comes the medical error, in which you or your department or your colleague may have made a medical error, and then you would have to talk to the patient or talk to the relative, be apologetic about it, and then manage the entire situation, making sure that you do the damage control, and that is what they want to see, that how well are you able to uh, manage a situation like this. Okay, and then similar to the medical error is the angry patient category, in which a patient may be very angry at you for it can be because of any reason, maybe because you have made a medical error before, and that is why the patient is angry, or maybe the patient is just angry uh, for unreasonable causes, okay, which doesn't make sense. Maybe you guys, the hospital is doing everything right, the doctor has done everything right, there is nothing wrong that could have been done, but still the patient is angry. Okay, so how are you going to manage those situations? That is the difference between the medical error and the angry patient. Okay, in the medical error, you are at fault, you are definitely at fault. Okay, or you or your department. In the angry patient, you may or may not be at fault. All right, so there is a different way, there is a slightly different way to tackle both of the scenarios, both of the situations. That okay, if you have made a medical error, how you're going to do that, and if you have not made a medical error, and if the patient is just angry for no good reason, because we all encounter patient like this, then how you're going to manage it. Okay, the next category in the ethical scenario is the confidentiality. Okay, GMC is testing how well you're able to maintain confidentiality. Maybe a relative might come to you and ask that, okay, my daughter came to you, or my son came to you earlier. Can you please tell me what did he talk about? Can you please tell me which medications you gave to him? Or maybe a doctor or someone from the NHS might come to you and say that, okay, Mr. XYZ is my relative, or Mrs. XYZ is my mother, and I want to see her reports. Can I see that? Okay, so you would have to manage those things along the your ethics and your ethics of confidentiality. That is where you would have to, that is how you would have to manage this particular case. Then there are general scenarios for ethics, in which a patient might be asking for a sick note, or maybe the patient might be saying that, can you just please fabricate my notes, or can you just write me a different note so that I can get some financial compensation, so that I can get some off from my workplace. Okay, so they would be testing you on scenarios like this. Okay, that what are you going to do in situation like this? Okay, so that is what three categories were. Okay, and three categories, you saw that there were multiple subcategories. Okay, and why am I categorizing it? Because each and every category and each and every subcategory have a different way to go about it. Okay, you cannot just apply one structure to the entire exam. If you're doing that, you're going to end up messing up, and you're going to end up failing the exam. So you need to understand what the categories are, what the subcategories are, and then you would be better able to understand that what type of structure you need to follow and how you need to go about it in when it comes to a particular category. Okay. All right, yeah. So now moving on to the next category, the fourth category is the medical diagnostics category. So it's a huge category. There are like more than 100 cases that you're going to find in this category, but it's a simple category as well. The patient may be coming to you with a complaint, with a symptom, and you would have to take the history. You would have to name some investigations or perform some investigations if it's a combined session, and come to a diagnosis and manage the patient and address the concerns of the patient. And it can be any presenting complaint leading to any diagnosis. Okay, as it's there on the screen, like there are around 9 to 10, in fact more than that, like 12 to 13 different presenting complaints that I have mentioned, and over 100 different differential diagnosis that needs to be there in your head. And that is why I said in the previous lecture that you cannot just get away by saying that this is a communication exam. You can see that there are so many differentials, there is so many medical aspect when it comes to the counseling stations. Okay, so you cannot just get away by ignoring the clinical knowledge aspect of the exam. There is a lot of clinical knowledge aspect that is involved, because if you do not have the idea of how to manage an ovarian carcinoma, you wouldn't be able to score anything in your management. Okay, so you should be aware of each and every management. You should be aware of each and every medical procedure, okay, that might be coming in the counseling session. Each and every investigation, why is it important, what is important. Okay, so the margin of error is like very very low. All right, and you need to make sure that you read stuff. Okay, you read those management pointers and you're very well versed with them. Okay. All right, the next category is one of my favorite categories. It's the simon. Okay, simon is basically the short form for a simulator or simulated man, you can call it. And the main idea behind it is that you've got 8 minutes to save a patient. Okay, so there would be a mannequin that would be present in the room when you enter inside the room and when you enter inside the cubicle, and a monitor would be attached, and the patient might be experiencing some life-threatening condition. It can be anaphylaxis, it can be COPD, it can be bleeding from anywhere, it can be opioid poisoning. Okay, the patient might be going into shock, patient might be going into sepsis. Okay, and as a doctor you need to be able to identify that and manage it in the right way. Okay, and there is a way and there is a very specific structure on how you have to manage the semen. Okay, so you've got technically 8 minutes to save a dying patient. Okay, and that is what the emergency situation is. That is what the uh, uh, what do I call it, the panic situation is. Okay, so you do not have a lot of time to like talk to the patient, and at the same time be very nice to the patient. Yes, you have to be nice to the patient, but it wouldn't give you that much time. Okay, because things are like, you need to be able to understand that things are urgent. Okay, and the urgency of your management, okay, how well you are able to you know deal a particular situation under pressure. Okay, that is what is being tested in cement, because this is a pressure situation, this is an urgent situation, a patient is dying. Okay, are you able to keep your calm, are you able to have some control over your nerves while you're managing such an emergency, such a life-threatening emergency? That is what Simon is. Okay, and we're going to discuss in detail how to go about semen in the upcoming lectures. Okay, then we have got prescription, in which there are multiple scenarios in which you'll have to write a safe prescription. There would be a prescription paper, there would be a scenario that would be given, some drugs would may or may not be mentioned. Okay, and you have to write down a prescription that is accurate, that is safe, that is correct, that is at the right dose, right frequency. Okay, and that is what is being tested, that are you able to write safe prescriptions, and are you able to understand what the importance of writing a safe prescription is. Okay, so there are around, I think, 35 different prescription cases that needs to be practiced. It needs to be written again and again, again and again, again and again, to master them. And one of them may come to you in your exam. And trust me on this, it seems very easy, that okay, it's just a prescription that we have to write. But prescription stations are one of the most commonly failed stations in plateau. Most people just end up getting 1 on 12. Some people I have seen getting a 0 on 12 in prescription. Okay, so it's not that simple as it seems. All right. The next category is the teaching stations, in which there might be a colleague or a medical student or a nurse that may come to you to learn about a particular thing. It can be ECG, it can be some examinations, it can be some procedures, or it can be some educational content like developmental milestones, vaccination schedule. Okay, it can be literally anything. Okay, and there are like uh, 13, 14 different type of stations which are commonly being tested as teaching stations. And recently, uh, uh, like people are, the GMCR is basically giving not one but more than one teaching stations as well in one exam. Like there is a possibility that you may get two teaching stations in one exam. Okay, so teaching stations are like really really important to understand. The content should be there in your head, and you should have practiced as well, that how to teach. Because it may seem easy that okay, I have got a lot of content in my brain, I've got a lot of content in my head, I'm just going to go out there and just teach. Okay, just like what I have to do, I just have to speak. All right, but no, the way you teach, okay, the way you check the understanding and how well you are teaching, okay, that is something which is getting marked, getting tested in this particular station. And the reason behind this is this, because a lot of positions in the NHS, when you inshallah get your GMC and get a job in the NHS, when you start working in the NHS, you're going to see that a lot of positions are teaching positions, and they have that culture of arranging teaching sessions and constantly having students around and teaching them different things, arranging teaching sessions. So they want to get that kind of a candidate who can teach well, and that is why teaching is very frequently tested in the exam. All right. Now moving on to the next category, that is the examination and the combined sessions. I did mention about it earlier on as well, that some of the session may be combined. Okay, and I talked about it when I was talking about the eye and the ENT cases. And as I mentioned, that all eye ENT cases can come as combined session. But yes, there are other stations as well, other topics as well, that may come to you as combined sessions. Like for example, the case of alcoholic liver disease, you might have to uh, do an abdominal examination. A patient with intestinal obstruction having a severe pain, shouting in the ER, and you might have to perform an examination on that patient as well. All right. But yeah, so since I mentioned this case, let me tell you, this is a tricky case. Okay, because intestinal obstruction patient would be in such a severe pain. The patient would be in such a severe pain that even though your task would say that okay, examine the patient, but the patient would not let you even touch the abdomen. Okay, now in your head you would have this thing in your mind that okay, this is a combined station. Okay, and I have to examine. If I do not examine, I would not get the finding, and I would not be able to reach to the diagnosis. And despite the fact that the patient is in so much pain, you'll go end up palpating and palpating, despite the fact that the patient is shouting. Okay, a very important tip, that in a scenario like this, in a situation like this, in any combined session like this, okay, if the patient is not comfortable, okay, if the patient is not allowing you to examine you, just step back. Okay, just say okay, fine, I'm going to examine you later on when you are comfortable, or I'm going to examine you later on when you are pain free. Okay, or I'm going to examine you later on when you feel that it's right to examine you right now. Just step back and just take a step back from your examination one. Because even though they've written it down that this is a combined session, that this is a session in which you have to perform the examination, at the back of it they're testing your IPS skills, that do you have that sympathy for the patient. Can you see that a particular patient is in a lot of pain, but are you just going to go and then examine just because you have to examine, just because examination is your job? Or are you going to sympathize with the patient and you're going to make sure that the patient is comfortable first, and then later on you can continue with your examination? That is what is being tested. Okay, and the moment you step back and the moment you prioritize the patient's comfort and the patient's condition before your job of examination, the examiner will automatically going to give you the findings that okay, this is what the finding is on abdominal examination. The abdomen is hard and the gut sounds not audible, whatever the findings are and what are the findings they want to give to you. Okay, so very very important. Combined session doesn't always mean that you have to go and do the examination. Sometimes your ethics might be tested at the back. Sometimes they may be focusing on more on your IPS skills as compared to your clinical examination skills by putting you in a scenario like this. Okay, so always remember, patient comfort, patient's consent, and patient's condition comes first before your job. All right. Yeah, antenatal examination might come, okay, for brief presentation, for normal presentation as well. You don't know what kind of antenatal exam that they might put you into. Digital rectal examination is something that you need to practice. Then there's a pulse speculum examination. Then breast examination may come. A testicular examination for different cases that are related to the testes. Then different joint examination is something that you have to practice, and you should be knowing about the steps, and you should be knowing about what to do in different type of station and different type of categories. Okay, yeah, so that was what the combined station were. Okay, uh, another category that is not very commonly tested, but it do tend to show up in the exam is the procedures. Okay, so you might be expected to do some daily procedures, day-to-day procedures that junior doctors are usually doing in the ward. Like for example, you may be expected to do IV cannulation. Okay, you may be expected to do take a blood culture sample or a blood sample, and all of this thing of course on a mannequin. Okay, you might have to do an ABG, you might have to do a venipuncture. Okay, and urinary catheterization. It's been a long time the urinary catheterization haven't showed up in the exam, but yeah, it was there in the syllabus, and urinary catheterization did come up very frequently in the exam. Okay, so yeah, and then the category J is an additional category that I made for the news station, because they keep on adding up news stations. They keep on adding up news stations, and the topic that comes in the news station mostly lie in these categories only that I just shared with you. So uh, you need to again emphasizing very strongly on this, that you need to be aware of all these categories, and you need to be aware that what to do in what category, because it's very complex, it's very dense. It just took me just like it took me half an hour to just tell you guys that okay, what are the different type of categories and what are the different type of subcategories, so you can have the idea about the intensity of how dense the syllabus is, how dense the content of lab 2 is. Okay, so developing an understanding of it was very very important, and now since you have that understanding about what are the type of scenarios that might show up, now we will be in a better position to begin a preparation and see that okay, how to identify. In the next lecture what we are going to do is that we are going to see that how can we identify a particular type of session. How do we know that okay, like before even entering inside the room, how do we know that this is a medical history taking session, this is a counseling session, this is an ethical session, or in this session we have to teach, or in this session we have to be with a colleague. So that is what we're going to do in the next lecture. Okay, so I hope everything was clear to you. I hope everything was taught to you in detail, and if you still have any questions, any queries, please drop them down in the comment section below, or you can reach out to our socials and drop your queries over there. I would love to get back to you and address your concerns. Thank you so much.